We're very excited now to turn to our third and final conversation of the day about reimagining care for older adults, our dialogue on a really important topic for many of us, both personally and professionally. Stuart Butler, who is our Convergence board member, longstanding, and a senior fellow at the Brookings Institution. We really appreciate you, Stuart, being here with us today. Without further ado, and with tremendous thanks for your leadership, I'm going to turn it over to you to introduce the session.
Great. Well, thanks very much indeed, Amanda. And I'm delighted to see so many friends and also some people I've not met before, which is great. You know, this project on long-term care is really tailor-made for Convergence. I mean, it addresses a truly national crisis that people are very aware of. People just simply can't afford, or many people can't afford, nursing home care anymore if they need it. Even a shared room these days costs an average of $95,000 a year. So it's no surprise that people end up exhausting all their savings and on Medicaid. Also, many people, or most people, think that going into a nursing home is a last resort. They'd much rather be at home, but it's very difficult for them to do that, including to afford it. And it's also important to note that the caregiving workforce in this country, in nursing homes and in family care, in home care, is really miserably paid and poorly trained. Many of them themselves are actually on Medicaid and other forms of welfare. So it's a mess. And it's important, it's a tailor-made for Convergence, because to deal with this, you've got to think outside the box, and you've got to look at different coalitions and how to bring people together. We need to reimagine care and build a system that respects people's preferences and needs and is also financially viable. Now, interestingly, we found that there's actually broad agreement about the goal. There's not really a lot of disagreement about the need and the goal, but nursing home leaders and labor leaders, insurers, families, just so far really haven't been able to figure out workable ways to get there. So they need focus, they need creative thinking. Well, that's what Convergence was invented for, as we know. Now, we started working on this issue actually back in October 2020, and we began with a series of 3 brainstorming sessions, which brought together roughly, so actually over 60 people, different people, experts and stakeholders. And that was designed to just really test the waters on possible areas of agreement, and also to identify areas of conflict. And if you actually look on our website, you'll see a summary of those conversations. We followed this up by inviting a few of those people to write 2 pages, just 2 pages on their ideas for administrative steps that could be taken to address at least part of the problem. The idea of this series was to shake up thinking, to get reactions, to sort of see how people responded to this. And all of this work back in 2020 and 2021 was really a prelude to what then became a major Convergence project funded by the John A. Hartford Foundation and the SCAN Foundation. And that started last summer, and it's designed to go through this coming summer. And this project, the heart of this project, will be our traditional fully facilitated stakeholder meetings, and in which we explore potential areas of agreement for policy and practice reforms. And we're well underway in that series of meetings. We have a great team involved in this. Karen Hademan is the director. Isabel Hinestrosa manages the project and keeps us all on track. Pat Field is the facilitator. He's with the Consensus Building Institute, and we've used him on a number of projects. And he can read the room and figure out where the opportunities are and keep us moving forward. Just before we actually get into hearing from some of the people in that project and hearing from Isabel, let me just end by just making 3 points about important features of this particular project that in some ways differentiates it from others. The first is that the monthly dialogues that we hold are indeed private, like they are in all the dialogues that we use. But we actually do much more of this project in public than we've generally done in other projects. We generate products and spin off conversations that a wide group of people are invited to. And the aim is to really have a ripple effect, to build a wider constituency, to think about this and engage in it and give us feedback. And we produce written products. You'll see them on our website as well. So we're really kind of reaching out more broadly than we've typically done in other projects. And as I said, we publish, secondly, actual reports as we go along. There's much more written material about this project than is true than I think any other project that we've done. And the last thing I'll say is that this project is actually running in parallel with other projects being done in this field. And they're not in competition. We see ourselves as really building a wider audience and working very closely with these other groups. It's mutual reinforcement, learning from each other, and that will lead to a better result from all these projects that are taking place. And we feel that that will help us lead to a broad agreement and that we'll see a much wider group of individuals and organizations committed to getting the job done when we identify the areas of agreement. So let me end there and pass over to Isabel, who I said keeps us all on track on this project.
Thank you so much, Stuart. Thank you so much for that wonderful introduction on the background leading up to and on the current work and the vision of the dialogue. Good afternoon, everyone. It's an absolute pleasure to be here with you today. My name is Isabel Hinestrosa, and I am the manager of the Convergence Dialogue on Reimagining Care for Older Adults. I've been at Convergence for just over 4 years, during which time I had the pleasure of working on Convergence's former Future of Health project with Stuart, as well as with the current director of the Convergence Dialogue on Reimagining Care for Older Adults, the wonderful Karen Hederman, who is listening in today. So as we just heard Stuart describe, this project has gone through various iterations over the past 18 months to get to the dialogue stage that we are here to discuss today. We are fortunate to have a dialogue consisting of 39 brilliant, wonderful members, 3 of whom I have the absolute pleasure of introducing to you now. So please join me in welcoming Dr. Donna Benton, who is Research Associate Professor of Gerontology at the USC Leonard Davis School of Gerontology and Director of the USC Family Caregiver Support Center, Dr. Marc Cohen, co-director of the LeadingAge Long-Term Services and Support Center at UMass Boston and clinical professor in the Department of Gerontology at UMass Boston's McCormack Graduate School. Marc is also an anchor member of a previous Convergence Dialogue, which was the Long-Term Care Financing Collaborative, which I'm sure we'll hear some more about later. And Naomi Lopez, who is Director of Healthcare Policy at the Goldwater Institute. So welcome to you all, and thank you so much for joining us today. So over the next 30 or so minutes, you'll have the chance to hear from each of our panelists on their experience as members of the Convergence Dialogue on Reimagining Care for Older Adults and their individual goals and interests in envisioning an improved future of care for older adults in the United States. So as the conversation develops, please put your questions in the chat or use the raise hand feature, and I'll be happy to call on folks and elevate their questions. So without further ado, and to get the ball rolling, I would love to start by posing the following question to our panelists. As we described, people in our dialogue get along so well with each other. You're a collegial as well as a brilliant bunch, and it is easy to give the misimpression that you all agree on everything from the start. So I was wondering if you would be able to describe some ways in which you disagree with each other or come from different perspectives and priorities. So if anyone would like to start, or I can call on.
Sure, I'm happy
Thanks,
to
Marc.
start. First of all, thanks very much for having me. I appreciate being here. And I may have said this to Stuart at some point, but I find the Convergence experience to be one that really pulls together strange bedfellows and then succeeds in moving people toward consensus. So I'm thinking back to some of our earlier work where the one thing you know about this process is that it is not going to be a lot of people talking in an echo chamber to each other, but it's always the right people around the table. And by right people, what I mean is people that are bringing a wide range of views and spectrums to the discussion. So that's, and we disagree. Stuart mentioned, and it's true, I think what's so great about the process is there's a time that's spent on getting people to first agree at a high level to the goals. And that usually is pretty straightforward. It happens fairly quickly. Where people diverge is on how you get there. But having gone through that process of getting people to agree on goals, you build up trust between members. And so that people aren't necessarily questioning their colleagues' motives anymore. They're starting to question the substance of proposals and recommendations. It makes it much easier to get to agreement. And we disagree a lot about the ways to get there. But they are framed within this general context of trust, which is what, frankly, it makes Convergence sort of a catalyst, really, for supercharging expertise in a way that's collaborative.
Thanks so much, Marc. Yeah, absolutely. I think that you summed that up perfectly. You know, it's the nitty-gritty details that people can find some disagreement on. Naomi, do you have any comments on ways in which you've disagreed with your fellow dialogue members? Or
Yes, so I think Stuart and Marc mentioned something that's very important, and that is there really are shared goals. We all care about older Americans having more choices, having better access to care, and having better care. And so that really does, we are working towards the same goal. I come from more the center right political position, and I work a lot on the state level on issues like scope of practice, and at the federal level on things like medical innovation. And we're at a really exciting time in our history. The velocity of advancement in medical innovation has never been faster or more rapid. And so when we think about solutions and integrating things like wearable technology and telehealth and end-of-one treatments into what it means to age in society today, how can that impact the options that our older Americans have? I think that it really does create a fertile ground for really sharing ideas and collaborating. And it's really, anyone who works in healthcare, I've been working in healthcare for 25 years, there could be 100 of me, and there's no way I would cover all of the healthcare issues around. And I think really understanding, coming from healthcare policy, understanding that there's so much expertise in our group, there's an enormous amount of respect for the expertise and experiences that other members have had. And so by being able to learn from each other, we all understand that we're able to ultimately do more and accomplish more for these broader goals that we all share.
Thank you, Naomi. Donna, first of all, I have to say you always have the coolest Zoom backgrounds, and today's no exception. Donna, do you have any comments?
Thank you. In listening to this, I think one of the things is we're all, again, in agreement that we agree at these very high levels. And it's really that when we're walking along our path, some of us are dancing, some of us are just kind of just walking along at a different pace. Some people are looking off to the right, some are looking off to the left, but we're all kind of moving along in the same direction. And for our, where I see sometimes that I may be veering off the road here is that I tend to think about family systems, which is sometimes the dialogue seems to be very centered on the individual in every system. And I'm really always thinking generational and family systems, and having the ability to, and when I say family systems, I mean family and family of choice, and being able to integrate that and having the respect for those systems, as well as understanding, and I think that everyone still has this in mind, but I generally have a very a perspective of making sure that we look at cultural and ethnic integration, and not as an afterthought or as oh yeah, that's nice, but really looking at it from the systemic to the individual level. So sometimes I might be looking off in other directions and coming back and joining everyone else. But I think that as we can hear, even here, we really agree a lot on why we see this as an important conversation. And we're trying not to reinvent the wheel, but really make a new way of moving our whole society.
I love that. Not reinventing the wheel, but finding a new way to move. Thank you so much, Donna. Well, so Marc, as we mentioned previously, this is your second time being involved in a Convergence project. So I was wondering, you did speak a little bit, about your experience in Convergence dialogues, but I was wondering if you could speak to your time as a member of the Convergence Long-Term Care Financing Collaborative and how that work ties into the current dialogue.
Sure, thanks. So, yeah, the original discussion that we got into really had to do with ways to improve the financing of long-term care, which has always been a very big challenge. And I think many of us witnessed that, in the recent period with the pandemic. What happens when you have an underfunded infrastructure? And, we really saw the terrible events of that. And so the group came together to discuss the issue of long-term care financing. And there were a couple of things that really struck me about that. And I won't go on for very long, but a couple of things in particular. One was that the way that the discussions were structured, it became very clear that a lot of times when you go to meetings, people are really anxious to talk because they want to make a point. And the way that these meetings were structured, it was clear that the idea was not just to make a point, but to try and make a difference. And that raised the level of debate across right, left, and center. My role, actually, I've been involved in research and policy analysis on the private sector for the most part. So my job during those early meetings was to present empirical data to inform the discussions and so on. And so we had, I think it lasted a good number of years. And I participated more as an expert on the topic. And then we started to coalesce around a broad solution. And it took a while to get there, but one of the things that I saw happen during that period was that I saw this for myself. I changed my mind. I've been in this field for many, many years, and working through the process, I saw that you could teach an old dog new tricks. I always had the feeling that, it's much easier to make up your mind rather than to change your mind. That process led me to change my mind. After getting a broad parameters for a program, I then went off on my own with another colleague, and we fleshed it out in detail into a concrete policy proposal. And now it is in Congress with Congressman Swazi, something called the WISH Act that he is trying to get people to sign on to. The point is, it all started from a number of years ago, getting all these people together. And now that is feeding into, to some degree, as we talk about reimagining care, on the financing piece, that is one of the pieces. So it's been, I guess, Stuart, 5 years or so.
It's like homecoming. I mean, it's a Convergence homecoming. And it also underscores just how timing is everything in a way, and ideas that develop, you can't guarantee that they can immediately go in effect. You've got to keep them warm. You've got to keep thinking about them, as Marc and others on that previous project absolutely did. I want to say something quickly, Isabel, also, that Absolutely. There are fundamental issues here that in this current project that really are forcing some really hard thinking about how you kind of handle them and move forward. One that in fact, our last scheduled dialogue, focused on the workforce. There is broad agreement, as I mentioned at the beginning, that the workforce in this area, the people who do caring professionally, are terribly underpaid, badly trained and so on. There needs to be more resources put into that. But as soon as you say that, then other people around people are saying, no, wait a minute, who's going to be holding the bag on this? nursing homes start getting worried that they're just going to be told to increase pay and so on. And many of them say, we'll go bankrupt if you make us do that. People like Naomi and I think, well, yeah, if it's passed to the Medicare or Medicaid program, these are in bad shape already. So the idea of piling a new entitlement in some way. So we have to figure out ways to resolve this. So at the same time, as I said, there's broad agreement about where we want to end up. There are really tough issues that have to be addressed in this and choices that have to be made. And that's where the rubber meets the road in these areas. And that's why, the facilitators that we have, the leads like Karen and Patfield are so important to this process, because they're skilled in how you address these things where two kind of approaches are hitting head on, and you need to find maybe a third way, maybe a negotiated sort of agreement, maybe some other way of doing things. That's so important to getting breakthroughs.
Thank you, Stuart.
And I think we also uncover some simpler ideas that no one's really thought about yet. For example, when we talk about zoning granny cottages so that older Americans can age in place closer to their families, for example. And so that's one policy solution that I think we uncovered kind of in an organic way that's not quite as complicated as what Stuart was explaining in terms of properly financing workforce. And so we are also, we are working on the very, very hard issues, but we also discover some of the simpler problems some of the simpler solutions that are already there that we can implement much faster. And so that's also one of the benefits of this type of approach.
I also think one of the things, when we were talking about looking at nursing home and financing, we went a little beyond financing and started discussing what's important for the workforce besides money. Because, it's like when someone volunteers, they're not volunteering for the pay, they're volunteering many times for the recognition. And while we all like money, so we're not in disagreement that we're an underpaid, but it's the under respect and acknowledgement of the workforce that we need an attitude change. And so we're looking at solutions that might be around training and attitude, and that also help the workforce feel respected and allow for them to feel professionalized and move through the system so that they have a career pathway. So we've had that part of the discussion too. And again, we all know, where's the money going to come from, but it isn't always about money. And I think that that's also been an important part of the dialogue, because for the ethnic populations that have historically been in this care field, they are historically not respected and not valued for the work that has been done over generations. So I think that as we've been discussing that's just been a wonderful way of pulling things together in these dialogues.
And, unlike some Americans, we actually think that some other countries might be able to give us some lessons too. We're actually holding one of these spin-off events, activities, what we call drill downs, where we're actually having people from Europe and elsewhere really brainstorm with us about what they do. I mean, people in other countries do grow old as well. I mean, it turns out, and other countries have tried things. So we're going to learn from other countries as well. Not everybody here does that, as we know.
One other point on that, just to follow on to what Donna and Stuart said, it's very easy on these very complex issues to sort of become overwhelmed. And I would say that one of the things that works well when Karen is leading or others are leading is, they keep a group of people who have strong views from boiling the ocean. We try to keep it tractable, make sure to put things into the parking lot. We can't solve all facets of this problem. And that is hard to navigate, and it's hard for some people to do. But I have found, anyway, in my experience over the over the years working now in Reimagining and even prior on the collaborative, that worked well to keeping us focused. I would say at the end of this process, people, if they weren't this way beforehand, they become flaming pragmatists after. You know, the focus is on what can we get done.
Thank you, Marc. So we have a question from the chat. Sean Dunning asks, is there any concrete example of a proposed solution or progress in that direction that you have arrived at that wasn't apparent at the outset of the process? So Stuart, I don't know if you have any comments or.
Well, I do think that this whole issue of the workforce is probably one of those where rather than thinking of it only as how do we pay people more and so on, there's been a lot of discussion about thinking about, in fact, even calling it the workforce can be a misleading kind of way, that there's really a continuum of supports that are needed and skill sets and so on, and looking at ways of thinking about how to use people in this field differently, including things like breaking down the silos between skills. You know, so often, and it's true in acute care as well, but in long-term care, people are trained to do one particular thing. And then if you want something else done, you've got to bring in somebody else to do that particular thing. And there's a lot of interest in broadening licensing and training so that individual workers can do a multiple set of things. It turns out that, you know, Marc can probably, I hope you agree with me on this, but that tends to translate into better job satisfaction, a closer relationship between the workers and the people who care for them, and so on. So that's a rethinking. Not everybody came in thinking that way. They tended to think of specialization, more intense training in particular.
And it helps to build career ladders.
Absolutely,
which is really important for what people believe needs more the professionalization of this workforce. And you're right, it's that is quite consequential, and not something that, you know, jumps out at you right away, unless you've been really studying this issue for a long time.
I mean, the idea of having kind of a universal basic person who can go between settings is also fits with what, again, me going back to family values, because if someone transitions from home to nursing into board and care, they can also still have maybe that carer transition with them as part of the family unit. The person who's working can work in all of those environments. And so you keep that consistency for the person, and it allows for more building of trust. The other parts of discussions that came up were how to integrate nursing homes back into as a community setting, you know, to bring in different generations. Again, I always think if you can bring in generations into when we talk about aging, because we start aging at the beginning, and the more that we can begin to break down the fact that all of us should be invested in this process of aging, while we focus on the later years, it's still important to remember that we're all invested in the process of aging generally.
Absolutely.
Some of us have more experience than others.
Right.
Well put, Marc. Well, so we talked a little bit about how, you know, your individual perspectives and, you know, backgrounds have fed into the work of the dialogue, and, you know, ways that disagreement has presented itself. But I would love to hear you elaborate for the LC on the ways in which the work of the dialogue has helped you increase the impact of your daily work. So I wonder if Naomi or Marc or Donna, if you have any comments on that. Go ahead, Naomi.
Yes, so one of the issues that I work at the state level is telehealth, and Arizona passed a pretty substantial telehealth bill. And when people think about telehealth, they think about hailing their doctor on their smartphone. But the reality of what this particular legislation does, which will be, I believe, replicated in many states across the country, is it really does lay the groundwork to reimagine how hospital care is delivered, and reimagining how care through long-term care facilities is delivered, and how that can change over time by harnessing the technologies that already exist in order to give older Americans more choice, and for those Americans that are being cared for by family, giving them more support in order to meet that goal. And so that is, I think, one of the most important value adds for me is being plugged into these conversations and really being able to integrate what is being done in Convergence with what's actually happening on the ground at the state level, and really supercharging those solutions that we actually now can legally do more of. And so that's been just a tremendous benefit. And from where I sit, I'm able to take that information, those solutions, and the resources and generosity of time that the people in Convergence do provide, and to support efforts in other states as well.
I think that it's been great because we've a lot of what I've hear and learn in these dialogues, I can ponder on and try to go back and feel like, how can this work in California? So let's just say we tend to think that, as California goes, the rest of the nation, but actually we can actually learn from other parts of the nation in California. And so this has really been, we have a master plan for aging that we started a couple of years ago, and it's a 10-year master plan. But what we've learned from these dialogues is how can we continue to improve on that plan and feed into the different aspects of the master plan in California. So for me, it's been allowing me to bring ideas, and then when I'm in other meetings around this issue, say, hey, this is what I heard over here.
Just briefly to build on both what Naomi and Donna said, one of the big advantages that has really helped me in my daily work is it has completely broadened my network of people that I can feel comfortable going to. I can pick up a phone. Yes, people still call on the telephone, to get input or advice. That's number one. Number two, there shouldn't undervalue the materials that are actually put together for both as outputs, right? As Stuart talked about, this particular project having a lot of written outputs, but the background materials leading up to some of our discussions and so on are enormously helpful in both, presentations to others that may be made, in helping to formulate, my own views. So those are some pretty big benefits that may not be the primary purpose of the group, but they may be somewhat incidental, but they're very important, I think, to all of the members.
Thank you, Marc. Absolutely. As this being my second Convergence dialogue, I can say that the relationships that are fostered among members is one of the most important and beautiful parts to see of the important work that you do together. So Stuart, you mentioned briefly in your introduction a little bit of these other parallel collaborative efforts that are going on alongside our dialogue. So I wonder if you could take some time to describe how the dialogue's efforts are integrated into the work of these other collaborative efforts, as well as each member's own universe of work, and speak to that.
Yeah, let me give you two quick examples, and there are others in addition to this. The National Academy of Medicine is actually producing a major report in April on the quality of care in nursing homes. There's actually, some overlap in terms of the personnel involved in that and the people in our project. We also know that what the National Academy will come out with a set of recommendations. And one of the things that we're doing is we're in touch with them. We share some of the insights and thinking that we have to them, and vice versa. And so that means that when that report comes out, we will be well positioned to help say which of these particular recommendations really have traction around a wide group of people and organizations and interest groups, if you like, and move it forward. That will help them be more successful. and it'll give us very firm recommendations to help bolster what we do. The other one I'll mention is an organization which you're probably not familiar with, which is called the Frameworks Institute. And what Frameworks does is actually look in great detail on a whole range of issues about how do people think about issues? And when I mentioned at the very beginning, most people in America think that going into the nursing home is like the end of the road. It's something that they really don't look forward to. That really comes out of that work. And Frameworks has been very helpful to us and other organizations in giving us a better sense of how people think about workers, nursing homes, and so on. And that's been very, very important in how we describe the words we actually use to talk about a number of these issues. So those are both examples where the work of other efforts in this area actually reinforce and help us. And what we do actually helps them sort of see where the possibilities are of agreement. So there are other examples too, but I think those are two very different ones, very different kinds of projects that are mutually reinforcing.
Thank you, Stuart. We have a question from Convergence CEO David Eisner. He asks, do you expect that participants will find it difficult to gain support for new ideas from their organizational colleagues who have not been in the dialogue?
No, I don't think so. And they're for a couple of reasons. One is that these are very well-informed discussions. They're serious. They are, we go through a very rigorous, thorough process of vetting these ideas, discussing them, going back and forth. And so by the time we have an idea to put forward, it is, it's solid. And so, for that reason alone. But secondly, the reality of the timing of these issues is something that, if someone doesn't want to get on board, they're going to miss the train. And so it really is, I think, time is of the essence. So anyone who doesn't want to participate in a constructive way is going to be left behind. These discussions are happening, change is coming. And so it's a question of whether or not you want a seat at the table. And so I think that this group is really providing an enormous amount of intellectual ammunition that is going to be used over and over again. But that's great news because it is based on a process, and maybe not, maybe an idea won't be adopted 100%, but it'll be 90%. And so I think that there will be a lot of buy-in for these particular ideas. It's gone through the rigorous process to move it forward.
Yeah, I'll add that I don't want to embarrass my colleagues here, but they are all highly respected out in general in their field. So people trust, Marc and Naomi and Donna and others to kind of speak for not just themselves, but for kind of a wide group of people. And then the other thing, as I mentioned, we have very much a kind of a public face to this project. We are engaging people who are not maybe members of the monthly dialogues, but their voices are being heard. And the ideas that we developed are being test marketed among those groups. So we certainly envision that when we have an agreement, that this will be one that people respect because of the people in it. And they will feel that they've got some element, some hand in those agreed positions. So that sort of inside-outside dynamic is a very important part of this particular project.
I just would add that I think the term new, the new ideas that come out of this are really one of the reasons that we may not have too much disagreement because, as you say, nothing new under the sun. And the dialogues allow us to, what may seem new to me is probably not new out there in the larger universe. So people will be able to say, oh, look, they're calling it a new idea, but there's this huge group that may not have had such a large voice that doesn't see it as new. So I think that that's going to be part of the recommendations and why some people will be able to latch on to many of the ideas in there.
Thank you so much, Donna. It looks like we are just at time. Marc, go ahead. I'll give you one last concluding comment.
I just wanted to say, this is a convergence, so I'll take a somewhat contrary view to what Naomi said, but maybe it's just a matter of perspective. I mean, it is true that the train is running. From my perspective, it's a very slow train that has been running for 30 years or so, as we talk about first the graying of America and then the silver tsunami and all that. But I'll maybe leave you with a quote, and Stuart knows this is one of my favorite quotes about what it is we're doing and timing. So the Nobel economist Milton Friedman said the following. I think it applies. Only a crisis, actual or perceived, produces real change. When that crisis occurs, the actions that are taken depend on the ideas that are lying around and developed. That, I believe, is our basic function, to develop alternatives to existing policies, to keep them alive and available until the politically impossible becomes the politically inevitable. And so I think much of what we do is keeping this alive and nurturing it. We may get very lucky, Naomi, and have some of this stuff adopted quickly. And I hope that's the case.
Marc, what a perfect way to wrap up our session. Thank you so much. Before we go, I just wanted to say this dialogue would not be possible without the generous support of the John A. Hartford Foundation and the SCAN Foundation. We've had Nancy Wexler of the John A. Hartford Foundation here with us at the LC. And I think also Ronnie Snyder and Terry Fulmer have been here. So welcome and thank you. And thank you to our fantastic panelists, Donna, Marc, Naomi, Stuart. Thank you so much for your time today and for providing this fascinating peek into the workings of the Convergence dialogue on reimagining care for older adults.